There are a total of 1,569 cases of COVID-19 in Arkansas, and though the number's rising, the timeline of the peak is changing. The governor is reassuring everyone that we've been successful in flattening what that peak will look like. A major announcement, too, coming from the governor today regarding help for the long-term care workers in our state. And Jay Bird joins us now with more on that. Jay?
Yeah, good evening, guys. The governor finally announcing that there are some of those bonus payments coming to healthcare workers, as he's been talking about that for a couple of weeks now, as Medicaid finally granted the state's waiver request.
But it does put them at risk, and it covers those that are directly dealing with COVID-19 patients, but it's also recognizing those that are putting themselves at risk simply with the at-risk categories.
Now, those who don't fall into that category, the state will divert roughly $50 million from the CARES Act money to provide those bonuses. It will include non-direct workers such as custodial staff as well. Healthcare workers relieved to finally get that boost.
When I hear these numbers and I hear about these cases, these aren't statistics to me. So this is a big deal for healthcare workers. Thank you to the governor for taking this upon himself to support our healthcare workers. We really appreciate it.
The governor also pointed out that the curve appears to be flattening in the state, and discussions will now commence on how the state will open back up.
It's going to be a gradual process that will have to be driven by the data, and we'll have to do it thoughtfully. If we start to see an increase in cases, we may have to reverse some of the measures that we've taken, but it will be a gradual process. And the third,
Arkansas has also been talking with neighboring states, similar to what the West Coast states have done, to discuss how to open things back up as a region.
We shared ideas. Everybody's in a different position. We looked at ways, and we have directed our chiefs of staff to continue those conversations. One, we learn from each other, but also we see if there's ways that we can act in concert together.
And to help with that planning, the Department of Health has now broadened the criteria for testing if it is available to anybody that is symptomatic. Before, you had to fall into one of those higher at-risk categories, such as being elderly, healthcare workers, etc. And then that'll do. Live from the state capitol, Jay Bird, KRK 4 News.